Technically, what I was asking about are things, risk factors for developing schizophrenia later in life. Do they include genetics, child abuse, head injury, and adolescent use of marijuana?
Yes.
Tori, I'm going to sort of skip forward a little bit. I know that jury's heard a lot about Mr. Jones' social history, a lot about his work history. So I'd like to sort of skip forward to your assessment of his psychological history.
Okay.
We start there.
Okay. Sure.
Can you tell ladies and gentlemen, the jury about his psychological history?
Yes, he has no history of psychiatric hospitalizations prior to his arrest. He had a history of substance use and got into trouble in high school and had to go into outpatient treatment after he was arrested for marijuana use. And that was actually back in 1999. And then his next evaluation was actually in the Navy, and that was in 2000. And at that time, he aspired to be a Navy SEAL. He was in basic training, I think, and was starting to have periods of depression, was crying a lot, and was referred for a psychological evaluation. And at that point, he was assessed to have depression. He was discharged. But there was also a risk of substance use, although not during that moment when he was being assessed. It was, I think, in the past. So,
did you review all of the records from the Navy?
Yes.
And is there anything in the records about Navy that says, my hip hurts, I can't be a Navy SEAL, so I'm quitting?
No.
What did it say?
It basically talked about that he was crying, isolative, and I think he was referred for a psychological evaluation. He was depressed.
Is boot camp a high-stress environment?
I would think so.
Did you have a quote at the top of page 14 about what was actually where he told the psychiatrist in the Navy?
I think she was actually a psychologist, if I remember correctly, Dr. Martinelli. But he said that, or she reported in her report that he was having mood swings all of his life, but he used to cycle every month or so. Now he cycles every 24 hours. He will feel okay 1 minute, and then he doesn't care about anything. He can't stop from crying at times.
And that was when he was diagnosed with the depressive disorder?
Yes, yes.
Moving forward in time a little bit, can you tell the ladies and jury about what Tim told you about his psychological history, what he told you about himself?
So that's the extent of what we have early on with him. When I actually interviewed him, he consistently told me that he started hearing voices at age 10. He also was ashamed of hearing voices. He did not want to be mentally ill like his mother. He never told anyone about the voices. He said that he would hear a few voices. He basically felt very isolated and lonely. He described the voices as inside of his head. He said he had a creepy male voice on occasion, but that was mainly, I think he specifically talked about the time of the offense, but he also talked about that in the past. The reason, when you're actually assessing a history of voices, we do have to rely somewhat on what they've told us, particularly when there are no treatment records during that time period. And the way that he described the voice actually seemed like a true hallucination. He said that the voices would come and go. They were inconsistent that they were intermittent as opposed to consistent, that they would go away with distraction. So if he was working on something or going to school, he was able to fight the voices. So those are more typical for true hallucinations. He did not say that he heard them all of the time and that he couldn't distract himself from the voices. And they were not continuous. And then he basically, we can talk as we move forward, the voices actually escalated around the time of the divorce and then on into the current day.
Did he also report having negative thoughts?
He did. He had both. He actually talked about negative, he didn't say negative self-talk, but just negative intrusive thoughts. When I was reviewing Dr. Frierson's report, he made mention of Tim using the word thought insertion. That came from me. That did not come from Tim. I actually saw him on several occasions before Dr. Frierson did the responsibility evaluation, and I had to ask him, do you ever feel like someone's putting thoughts into your head? That's called thought insertion. And he was mixing up the terms. I think what he was trying to say is that he had negative, intrusive thoughts, and that they were recurrent thoughts and that they were racing thoughts. And so that's the difference. But the term actually came from me.
And how about visual hallucinations? Tell you about visual hallucinations.
He did. I don't think that they are what we would consider visual hallucinations that are consistent with mental illness. They're actually visual hallucinations that are more typical for people who have sensory deprivation. Like if you're locked up in a cell without any kind of stimulation, you can start to see things. Or with sleep deprivation, sometimes we can see that. But I don't think they were consistent with mental illness.
And as far as you know, has Tim been held in isolation?
Yes.
Solitary?
Yes.
Can you tell, ladies and gentlemen, what he told you regarding the paranoia and delusional thing?
So his paranoia, he may have had it in the past, but it really started around 2012. And he started actually forming some delusional thinking about his ex-wife at that point. I don't think they were legally divorced then, but they definitely were separated. He believed that during that window that she was having an affair with the neighbor, which actually turned out to be true. But he had speculation that she was. He also, as the months went on, became more and more paranoid about her and the children. And obviously it escalated during the summer of 2014.
And did he seek counseling for?
He did. He did. He actually, through employee assistance at his work, he was, and this was in May of 2012, he was having severe anxiety and depression, went to see Dr. April Hames at that point for some counseling related to the separation from his wife.
So can we move forward towards the summer of 2014? How is he doing?
Let me add a couple of things from 2012. He did see Dr. Hames. She referred him to his family practitioner to get on some antidepressant medication and anti-anxiety medication. I don't think that he ever really took that. I mean, the follow-up note says that he was better, but when I've spoken with him about it, he really has very little memory of that. So I would suspect he didn't take it consistently if he took it at all.
Okay.
And then in the summer, so then we skip forward to 2014, and between 2012 and 2014, the actual divorce happened. And he, at times, I think, thought that he would get back with his ex-wife, but that did not happen. And he was very depressed and sad. He did terminate treatment with Dr. Hames in 2013, in the spring. Terminate's a strong word. I think he just quit going. But he was still having active symptoms of depression related to the divorce at that time period. But in 2014, his symptoms did escalate.
And at that time, did he sort of become paranoid and delusional about his ex-wife?
At which time?
In the summer of 2014.
Yes. So around, I think it was around May that he told me he started using spice. He had actually relapsed on alcohol and marijuana during his separation from her originally in 2012. And he used that heavily intermittently, and then he stopped for a period of time, and then he used it again. But around the time, around May of 2014, he actually was using spice and began escalating the dose of spice between May, June, and July of 2014.
Did he develop a delusional belief about his ex-wife being involved in a prostitution?
He did, and fortunately, we do have some excerpts from his, or extractions from his cell phone and computer. He was actually trying to find out if she had prostituted. He was paranoid that she was doing those things. He was also paranoid about his daughter. He felt like his daughter Mira could be schizophrenic or mentally ill. She was showing odd behaviors, in his opinion. And then as we move forward into June and July, so the paranoia is starting more at that point, and delusional thinking about them. You know, you've heard this term of fixed false belief being a delusion. You know, this was a little more fluid. He was having those thoughts, but they were all specific to his family, his children, and his wife, and they were very paranoid. So it wasn't one fixed delusion that held itself over months. It was generally delusional thinking about his family.
Does Mr. Jones, in reviewing his psychiatric history, does he have a history of manic symptoms?
He does. So in June of 2014, again, we're a couple of months before the offense, he starts exhibiting some manic behavior. And let me explain what that is. In that month, he started thinking about changes in his life. I think at that point he really did realize that the marriage, he was not going to get back into that relationship again. But he started having these grandiose thoughts that he would go to medical school, that he potentially could teach in Korea, that he may move to Vancouver, that, you know, and probably the most reasonable thought was that he would move back to Mississippi to be close to his family and work. When I asked him about those thoughts, I said they're just random and disjointed. And they're not realistic. I mean, I went to medical school, and taking 5 kids out of the country to go to medical school and trying to manage 5 children while you're in school, it's just unrealistic. So I don't think he was planning the actual, what could happen if he actually chose to do that. In addition, financially, I don't know how he could have done that. So it was grandiose, in my opinion. I certainly think he was smart enough to do it. He got into medical school when he applied out of the country. But in that time period, it seemed very unrealistic as to how he would manage with that. And he also was focused on money, making lots of money. He was day trading, doing impulsive things, along with all the other things that he was doing with work, raising 5 children. And then as we started kind of into the July months, what I started to see was a lot of increase in goal-directed activity, which is very typical for manic behavior. And if you look at, we had his Google Calendar, I think it was in August, I don't have the dates in front of me, but he was doing things like between 8 and 8:15 in the morning, I'm going to practice Spanish, and then I'm going to work all day, and then I'm going to take care of my 5 children, and then we're going to pray together, and then I'm going to study Hebrew for an hour, and then I'm going to day trade for 2 hours. Sorry, I'm going too fast. Sorry. And it just went on and on. And then what was paired with that was what we have from his computer and his cell phone is that he was up at night. So at least from the 24th of August until the 28th, the day of the offense, he wasn't sleeping. He would sleep here and there, but if you really pull the information, we have evidence that he was up for several nights. And that is a classic symptom of mania. So between that, the grandiose thinking, the fact that he has this increase in goal-directed activity, he's irritable, agitated, labile. Times he feels probably happy and normal, but at other times he's very irritable. Those are classic symptoms of mania.
And did he also report active depressive symptoms?
He did. He had some mixed periods of depressed mood, suicidal thinking, hopelessness, lack of concentration. You know, this is where there's crossover between mood symptoms and thought disorder symptoms. He was reportedly unkempt, like he didn't care how he looked. His manager, I think, and coworkers had said that he basically was, you know, making some errors at work, had missed some work over the summer, obviously missed, I think it was that Monday or Tuesday before the actual offense happened, was had trouble getting his kids to school on time, so a little disheveled. All those are classic symptoms of what could be depression, but also if you're manic and disorganized in your thinking, it could apply to that too.
Just staying with his psychiatric history, and I know that you had been meeting with him for a little while. For most of the times that you met with him, was he stable?
Okay, so we're shifting now to my time of evaluation, not his report of the offense. So I actually saw him beginning in August of 2017, and I met with him at least 4 occasions in August through October, and then I met with him in April of 2018, the fall of 2018, January of 2019, and then just 3 or 4 weeks ago. So during the first several visits with him, he was on high doses of medication. He was not sedated, but he definitely was slower in his thinking. And then as we got to the time period around fall of 2018, I think that's when he was not getting his medicine regularly, and he was having withdrawal from the medicine. And it's significant when you go from 320 milligrams of Geodone to 0. And there were several incidents where he was not receiving medicine. And I saw him during that window, and he was tearful, hadn't slept for 2 weeks. He wasn't hallucinating at all, but his mood dysregulation was more prominent in November of 2018 when the meds were actually withheld. And what he told Dr. Wood at that time was that I can't stand the way I feel when the meds aren't given to me. So is there a way that we can actually taper these medications? And she did. I think she was tapering his meds, and he was not doing well with that. He was moved over to Lexington County Jail, I think at the end of December of 2018, and has been there since. And since that time period, when I did meet with him in January, he was a little hypomanic, actually, in January. He had pressured speech. He was talking about, God. He was talking about how he's going to win this case. He was just a little grandiose, in my opinion, and unrealistic, jokesome with me, which I'd not seen before. And during that window, Dr. Wood had prescribed Depakote, which is an anticonvulsant that we use for bipolar disorder and for other things, but for mood disorders, and he was stabilizing on that. When I saw him again in May, 3 or 4 weeks ago, he was much better in his mood, but for the first time in years, the voices were starting to come back.
And the Depakote, was that something that you had suggested?
In January, when I saw him, and I was concerned that he was starting to rev up a little bit, I said he did not want to go back on more of Geodone because he did not want to feel tired, and he didn't want the withdrawal if he couldn't get it, or the food that he needed to make it work. I said you need to speak with Dr. Wood about maybe looking at a mood stabilizer for you that would help with the manic symptoms. And I suggested Depakote to talk to her about, and I think that's what she prescribed. Actually, I don't know. I think either a nurse practitioner or another doctor is actually prescribing it at Lexington County Jail now. So, well, actually, I think Dr. Schwartz-Maddox has prescribed it more recently. And that was maybe Geodone instead.
I want to move forward just a little bit and sort of, I know that you talked about the family psychiatric history. Can you just sort of briefly summarize the family psychiatric history?
Yes. Mr. Jones has an extensive family history, and I counted about 20 family members who have major mental health problems, substance abuse problems, several suicides in his family. So I hope I counted the math. I counted that up right, but it's around 20 family members. And illnesses such as schizophrenia and bipolar disorder.
Kind of move forward towards Mr. Jones's mental status examination.
Yes. What page are you on?
Give your report.
Yes. Okay.
Can you tell the jury about your mental status examination?
Yes. So because I saw him on 8 different occasions, I'll just summarize what I observed overall. During the first 4 times that I saw him, which again is August of 17, kind of through the October 17 window, he was not complaining of any psychotic symptoms. He did not complain of voices. He did not complain of any manic behavior. He was not suicidal. He was very stable on his medication. He was on high doses of Geodone at that time, but I did not see any active symptoms of psychosis or of mania during that window of time. And then, like I said, in the fall of 2018, his medications were changed because he wasn't receiving them on a regular schedule. And at that point, he had been weaned down significantly from his antipsychotic medication. And at that point, I was starting to see the mood symptoms come back and the withdrawal from the Geodone. And then as we move into the winter months, into the early part of 2019, he was put on a mood stabilizer for the manic behavior that we were starting to see again. And that did get better. He was much better with that when I saw him in May. But what happened around March to April of this year, and he told me this on May 4th when I saw him, was that he was starting to hear voices again. And at that point, I don't recall if he was taking 20 milligrams or 40 milligrams of Geodone. Again, those doses are very low compared to 320 milligrams that he was on the first few years of his incarceration. But he was starting to hear voices intermittently, and he just would distract himself from the voices in the cell.
Can you tell the ladies and gentlemen, jury, so why is it important that you saw him when he was sort of not getting his medications, and what his mood and other symptoms were?
I mean, I think what I'm trying to assess is, was this a snapshot in time when he just had illness related to the drug? Was this something that, has continued? And this many years out, when you make those medication changes, you should not have those types of symptoms if there's no illness. So it helped me to really define the diagnosis, but also, and I knew the diagnosis probably, by early January for sure, because I was starting to see those symptoms come even in the late fall. But, and then I was always looking for malingering. If he was feigning, I wanted to know that. I discussed that with Dr. Wood in detail, if she felt like he had feigned symptoms, and she said no. And there was nothing to support that. He was very cooperative with all of us, as far as I know, all the evaluators who've worked with him. Dr. Frierson had not diagnosed malingering. I didn't see anything that looked like malingering. This is just illness, and it obviously was at its worst point when this happened, and it's been treated ever since that time period. So.
Can you tell the jury about your diagnostic assessment and what diagnosis
Yes.
you eventually concluded, and can you use chart to tell them why?
Yes. So if you look at the chart, and again, let's refer to just the red. I'm going to try to use this pointer. There we go. The red circle. Oh, sorry, it's hard to point. The red circle and the blue circle. Those are the diagnoses that we need to focus on, and those are. On the red side, this is the thought disorder side, or the schizophrenia side of schizoaffective disorder. And the blue side is the mood disorder side, or the bipolar side. And so during this time period on 8/28, he had symptoms of both. These symptoms were starting to escalate in the summer months, and these were escalating in the summer months and really came to a high level on the day of the offense. What complicates it even more, though, is this middle circle, because there is spice that exacerbates this pre-existing condition, and there is this head injury that can cause frontal disinhibition and make someone act more impulsively if they have that head injury. It's associated with that. So what I did on this word disinhibition is I tried to put that with these three particular conditions, not here. Disinhibition is focused more with mood disorder, substance use, and head injury. And these all four of these came to a head during this time period.
And so what was your ultimate diagnosis?
So my diagnosis for mental illness is schizoaffective disorder. It is a combination of psychotic symptoms or thought disorder and a mood disorder. Which is, in his case, suggestive of bipolar disorder. I actually thought he was manic during the time period of the crime. I do feel like that Dr. Wood feels like she's seen more depression with him. I think it's complicated with grief as he's been in prison, but he's also been treated with an anti-manic, if you would, medication, Geodone, since I think the 12th of September 2014. So I doubt you would actually see manic symptoms until those medications are removed.
Can you tell us about sort of his mental functioning in the week leading up to kill?
During the week. So I think I've touched on those months leading up to the time of the offense. That particular week, and let's say, so if this happened on a Thursday night, on Monday of that week, when I mentioned earlier that he wasn't sleeping, I think if you look at what we have from his phone and computer records, I mean, he was up on 8/24 into the morning of 8/25, and this is 3 days before the alleged offense. He was up from 11 o'clock at night until 3 a.m. On the evening of the 26th, going into the 27th, he was up from 11 p.m. until 6 a.m. and then went to work all day. And then on the evening of the 27th, going into the evening of the 28th, or going into 8/28, he was up from 5 p.m. until 6 a.m. And then that's the day of the alleged offense. So he's not sleeping. If you look at the Google Calendar notifications, like I said earlier, he would actually, each day, he had increased goal-directed activity. He would study Spanish in the morning for 15 minutes, study Hebrew at night from 9 to 10. He would exercise Monday, Wednesday, and Friday from 7:30 to 8:30. He would study day trading from 10 p.m. to 12 midnight, along with working, taking care of 5 children, and reading and praying with his children. All of that suggests manic behavior. And that's during this window of time that we're talking about.
Did he have and I'm looking at page 23 of the second paragraph, did he have a description of his thoughts that were going on at that time?
Okay, so if we go to that, which paragraph are you referring to?
Up at the top, the second one.
Oh, okay, all right. Oh, the 2 weeks before the offense? Okay. So this would get us to mid-August, basically. The offense is at the end of August. He was complaining of little sleep. He complained of having pounding thoughts. I asked him what that meant, and he said just racing thoughts. They wouldn't stop. They interfered with his functioning. He wasn't sleeping. He reported periods of irritability. He was short with the kids, as we know. He believed that the kids were colluding with Amber to harm him in some way, even though that's not realistic. These are young children. He was easily agitated with his kids and his family. He was depressed about his failed marriage. He was depressed that he actually was not going to church and he wasn't following the Bible as much as he should. So he was putting a lot of pressure on himself to get back into his studies with the Bible. He felt depressed. He felt suicidal at times. He did miss work some. He missed earlier during the week of the offense. He was late taking the kids to school. And then intermixed with that was this kind of grandiose focus on going to medical school in the Caribbean and how he would accomplish that. Along with those things, he was using spice 5 times a day, or up to 5 times a day. And he says that he did that to curb the voices in his head and to calm him down. Now, when I evaluated him for a drug-induced psychotic disorder, which I do feel like it contributed, I basically said to him, if you were doing that up to 5 times a day for 3 months, why did this happen then? And in my opinion, if it is all spice related, why didn't it happen a few months before? Why did it happen at that particular moment? It happened because there were other things going on.
Okay. Well, did you then talk to Tim about what had happened? What his account of the offenses were?
Yes. Yeah, and his account, what he gave me is actually very similar to what he gave Dr. Frierson. And I think he was consistent with pretty much the same sequence of events. There was probably one inconsistency when I asked him, he'd gone to work that day. He went to pick up his children. He was feeding them dinner. He had used spice that day on at least 3 occasions. And he became angry with Natan for a blown outlet that was in the living area. He said he spanked him. He blew 4 outlets. He was out to get me. He wanted to move back with his mom. I was paranoid. I thought he was going to kill me with electricity. He was fascinated with electricity. I was paranoid. He was either going to start a fire or do something to kill me with electricity. And then he kept pressuring Natan to tell him what had happened. And when I asked him about that, he said, I didn't know if his mom was, conspiring, if they were going to do something to harm me. And that's when he brought in Amber in the discussion. He did say that Amber called during that time period, and Natan did claim to her it was an accident. Mr. Jones became very angry with Amber and did not want her interfering. He didn't feel like she was capable of raising their children, and he did curse at her. So after Natan would not admit that he'd blown the outlets, Mr. Jones began to PT him. And basically, when I asked him what that meant, he said I would have all the children, when I PT'd them, do squats, push-ups, nose and toes, those kinds of things. And I said, when would you do that? He said he would actually do that when they were, obviously disobedient. He would spank them if they lied or they fought with each other. So he did believe in that. He believed that that was very, for his religion, that he could discipline his children, and that was acceptable, even though he did not realize that it could be too aggressive.
So, do you know if that outlet was ever tested?
I do. I received information. I think Dr. Frierson had requested an electrician to look at that, and I do think that, I got that information back, and it was blown.
Okay. Or it wasn't working?
It wasn't working, sorry.
So he is PT in Natan, and then what does he tell you happened?
So he did give me a couple of inconsistencies on how long he asked Natan to PT, and he said one time it was about an hour. The rest of the interviews he actually said, I think it was 45 minutes. And then he basically, Natan wouldn't speak to his father. He sent him to his room, and then when he went in to check on Natan, he remembers shaking Natan, and Natan kind of passing out. He put him in bed. He went to get water. He returned. He realized he wasn't breathing, and he panicked. He knew he was not breathing. He knew he was dead. These are his quotes. I was horrified. I was hearing voices and thinking about the kids and what would happen to them if something happened to me. When asked what he meant by that, he said, if I go to jail. He did not call the police because he believed that they would think that he had killed him. Mr. Jones repeatedly stated he had no intention of killing Natan and that he was only punishing him for not answering him about the outlets. Mr. Jones stated he knew that their mom was not around and that they could not depend on her.
So then what happened?
So then he said Mira and Eli came into the room and Natan wasn't breathing. Mr. Jones told them he believed Natan was dead. He asked them to leave the room and go into the living room. He left the room, smoked a cigarette, took Mira with him to buy more cigarettes. I think that was later. He couldn't give me a time frame on that. He purchased 10 packs of cigarettes and then headed back to his home.
And did something happen while he was on his way back to the house?
Yes. He heard a voice, a kind of a creepy voice to kill the kids. He stated it was not a thought, but a voice. It was inside his head. When he returned home, the other children were asleep, and the youngest two were in the back. The older two were in the living area. And then he started thinking about what would happen. If he were to go to jail, what would happen to the kids? And he believed that they would be better off in heaven than to not have a parent, that he would be in prison, that their mother would not be there for them, and that's when he believed that he would, quote, send them to the other side, no pain or suffering then. He stated he was hearing voices, had high levels of anxiety, racing thoughts. He didn't want to have his kids to have a life without their mother. He knew it would be better for them to take their He knew it would be better for him to take their lives than to live without a mother, and they would be better off in heaven. He didn't think about other options during that time period. He did not think about his children going to live with his father or with his grandmother. I asked him specifically why he didn't think about that. He just said he was so anxious and hallucinating and so agitated and obviously just confused that he did not think about that. So, and then he smoked 1 to 2 bowls of spice, went to the living room where the older 2 children were sleeping, and that's when he put his hands around Eli's neck. I'm sorry, he put his hands around Mira's neck, and then Eli's neck, and then he obviously strangled the younger 2 with a belt.
Did Eli say anything to him?
Yes.
What did Tim tell you Eli said?
He said, Dad, take me with you.
And how about Mira? Did Mira say anything?
He said that Mira resisted, and, you know, I thought it was interesting he told me that, because if he was making up the story, that certainly doesn't support him in any way, but he did say that she resisted when he choked her.
Did he tell her?
He didn't tell me he did tell me he loved her and that he would see her again in heaven. And Gabriel told him that he loved him before he died. And Mr. Jones told Gabriel he loved him too.
After this happened, what did Mr. Jones say he did?
He told me that he overdosed on 7 to 8 bowls of spice, that he wanted to die. He did awaken, and he realized what had happened. He knew he would go to jail. And then the next several days, he drove aimlessly around South Carolina, Georgia, Alabama, Mississippi. He thought about escaping to places such as Mexico, Las Vegas. He knew he'd be found by the police. He bought cleaning supplies, tools to dispose of the bodies. He bought muriatic acid, a saw, trash bags, bleach. I mean, he willingly told me all of that. When he left Lexington, he wrapped the bodies in sheets and blankets, put them in the back of his SUV, where they remained for several days. Sorry, I'm going too fast. Sorry. He wrapped the bodies in sheets and blankets and put them in the back of his SUV, where he remained for several days, where they remained for several days as he drove. And then he later disposed of the bodies in a wooded area in Alabama.
We're going to come back to your evaluation and conclusions regarding criminal responsibility of those actions. And just sort of want to briefly summarize the collateral sources of information that you had supporting mental illness at the time
Okay.
of the killing. Can you briefly summarize that?
Yes. Well, I think we've touched on the military history diagnosis, or when he was actually assessed by Dr. Martinelli in the Navy. We've also touched on the fact he saw Dr. Haynes for counseling after his separation for anxiety and depression. He also was briefly prescribed antidepressant and anti-anxiety medication if he took that. I don't know that he did. And then I think the next information actually goes to the time at Lexington County Jail after he was arrested. So this is actually a medical record note from September 11th, 2014. He was on suicide watch at that time, and he was reporting a history of hearing voices and seeing things. And his quote was, "I hear voices when I'm not busy doing things. I hear voices when I did it. I was hearing voices when I did it. I see shapes like squares on the wall that change shapes." He reported that he was self-medicating at times to cope with the voices, and he was too embarrassed to seek mental health treatment. His mood was labile, and he complained of hallucinations. So that's just a few days after his arrest. And then the next note was on 9/12/14. Basically, he was, again, he talked about hearing and seeing things that other people don't hear or see. He stated random people pop up and tell him to hurt others. He was prescribed Geodone at that time period. And again, this is, a short time period after the arrest. And then, of course, Dr. Wood titrated his medication at that point. And then as we move on, in September of 2014, he continued to receive treatment with Dr. Wood. He continued to be on medication until this time period now. His hallucinations did resolve for a long period of time, and they've just more recently come back.
I'm going to skip forward to your sort of collateral sources around number 11, 12. Did you also look at discovery, listen to interviews with Mr. Jones, read the police reports involving Mr. Jones, listen to what he had told the police? And if so, what was important to you about those interactions?
I did. I mean, I obviously reviewed thousands of pages of information, and the police reports were part of that. All of the state discovery was part of that. I found it very helpful. There was on September 7th, which is the day after his arrest, he was meeting with law enforcement, and his quote on that, in that interview, and I'd like to read that, to me was significant. Again, this is the day after his arrest, so he's not met with a psychiatrist at that point. So these are quotes from him, and without any ability to talk with a mental health professional or, research how to fake this if he was going to fake it. But he basically said that he was pleading the Fifth.
Sorry. Can I step you down to
Yeah.
where she passed it?
Where?
She
Can we
passed
just ask
me
that be stricken from the record?
Brandon, the legal issue, she's not here to testify about legal issues. She's here to testify about psychiatric issues. So anything about rights is stricken, y'all not considered, okay?
Sorry.
That's right.
Okay. Can I start with she passed it on to me? Okay, sorry. Mr. Jones said she passed it on to me, the voices in my head. She gave me what she had, talking about his mom. I went off the deep end. She put it in my head. The only way you can fix me is to kill me. After Amber left me, it just came out of me. Put a bullet in my head to fix me. Voices are in my head. The investigator noted, quote, he thinks the kids want to kill him. He also noted Tim, quote, talked about the electrical outlets in the house and the child getting electrocuted. Kid stuck his tongue in socket. Kids would cut him up with a knife.
And was there another report from, and I know that you had said, Trent Weeks, if you learned that probably Eric Johnson
Yes.
regarding that incident?
Yes. So Eric Johnson, and in my report, it was a report written by Trent Weeks, but it was actually Eric Johnson's information, I think, about his interview with Mr. Jones. And that was on 9/7 also. He quotes, acting in such a manner that I have never seen. He was sweating profusely in a cold room with beads of sweat dripping from his hair. He would scream out that it was Cindy, that's his mother, who put these voices in his head, and that Cindy passed this on to him. She put this poison in my head. The investigator noted the following, quote, profuse sweating, foaming at the mouth, yelling or screaming out, burst of anger, and fear of the children.
Now, are those symptoms of use of spice, or are they symptoms of mental illness? What was your opinion regarding those statements?
Well, it could be both. Clearly, I think that there was illness there, and the spice obviously aggravated that more. So.
Did you also review his interactions with Detective Creech and the Special Agent Mackey on the 8th?
Yes.
And what, if anything, about those was significant to you?
So I thought this was actually one of the most helpful interviews when you're trying to figure out mental state around the time of the offense. And I actually listened to that interview several times. Mr. Jones's speech was very pressured, and it was disjointed. He seemed to hop around when he was talking. He cried intermittently, which really shows mood lability. He specifically cried when he was talking about choking his children and stating he believed he was mentally ill. He discussed the voices in his head at the time of the offenses, and he also said he was having, quote, 100 thoughts of what he was going to do after the offenses. He reported he heard voices and seeing things both on and off drugs. He stated on the day of the crime, the voices ran rampant in his head. He stated he believed the children were conspiring against him. He stated he would do the same thing if a police officer had been there and he saw himself as a target.
Did they ask him if he knew it was wrong?
Yes, and he basically said he would have done the same thing if a police officer had been there. So that indicates, and he was talking about the Natan situation, that indicates that the whole issue of punishing Natan in his mind was not legally wrong.
Okay. And was there a particular way that he talked about the voices that was significant?
Yeah, and this is the difference between an auditory hallucination and a thought. So if someone is having recurrent negative thoughts, like if we're upset about something, we have negative thoughts about ourselves, we're thinking, what am I going to do? So you kind of think about it as you're talking to yourself. But if it's a hallucination, and particularly in Mr. Jones's case, he actually was hearing, what is Tim going to do? So he was hearing a third party, actually, that third party voice. And so I feel like that's more consistent with a true hallucination versus a thought.
Can you tell us what else you reviewed or had as
Yes.
your collateral sources of information about?
We did have some recorded phone conversations between Amber Jones, his ex-wife, Mr. Jones Sr., and Mrs. Julie Jones, his stepmother, during that window when Tim was actually missing. And they had discussion about, and I'll just quote what Amber Jones said, Tim needs help really bad. I even told him that he needs to be on some kind of medication. He needs like a psychiatrist or something. He really does need help badly. And then there was another conversation. I don't know if that was a separate conversation, but with the same people. Yes, it was separate because it was following his arrest. Mrs. Jones, Amber Jones, indicated that Tim was, quote, losing it when they moved to South Carolina and turned into, quote, a completely different person. Mr. Jones Sr. stated, quote, he was not right, and she discussed his erratic behavior.
What else?
And then the final pieces were these things I've already mentioned. One is just looking at the Google Calendar and his kind of increase in kind of daily structured activities. And then also the same month in August when this happened, his insomnia.
Okay, and I believe you've already sort of summarized for the jury his Dr. Snyder and Dr. Bigler's findings regarding his
Yes.
history of the
Yes, just the head injury component, which to me was a contributing factor to his disinhibition.
And then, so can we talk about the spice and the exacerbation of existing mental illness?
Yes, so he did test positive for spice, which to me is a contributing factor for exacerbating his mental illness during that time period.
And so did you review the records and all the information that you had to figure out whether or not he might be malignant?
Yes, I did. I looked at, obviously, multiple examiners' reports, all of Dr. Wood's records, my interviews. I've met with him on many occasions, and none of those have suggested malingering. There was one, I think there was one note in the prison by a staff member that maybe questioned malingering, but there are hundreds and hundreds of pages that do not support that, so.
So can we talk about your findings about criminal responsibility?
Yes.
Can you tell the jury about how you came to the conclusions you did and why you did?
So again, when we're assessing criminal responsibility, we're assessing the time of the offense. And during that time period, it's my opinion that during the several weeks leading up to the offense and on the day of the offense, and for several weeks to months afterwards, he suffered from psychotic thinking, specifically delusional thinking and hallucinations. He also had some negative symptoms, which I did not include in my report, but he had symptoms of psychosis along with a mood disorder, specifically a manic episode that is consistent with bipolar disorder. Those are two examples of a thought disorder and a mood disorder. It's a major mental illness, obviously, but it's a combined illness called schizoaffective disorder. So he has a major mental illness. He had a major mental illness on the day of the offense. And because of that mental illness, he was unable to recognize the legal wrongfulness as it related to Natan's death. He was unable to recognize or had the capacity to recognize that the difference between moral right from moral wrong as it relates to his 4 other children.
With regard to, and skipping over to where you talked about the South Carolina law on,
Yes.
on page 32. So what is the law in South Carolina with regard to not guilty by reason of consent?
Okay. So the law here is that a defendant, as a result of mental disease or defect, and in this case, schizoaffective disorder, lacked the capacity to distinguish moral or legal right from moral or legal wrong, or to recognize the particular act charged as morally or legally wrong.
And as to Mr. Jones' PT and Natan,
So Mr. Jones did not recognize that when he asked Natan when he was PTing Natan, that he would actually kill Natan or harm Natan in any significant way. And he even said that if a police officer had been there, he would have done the same thing.
now, have you also looked at some of the religious materials that Tim had about disciplining children and the rod is love and
Yes.
not the home series?
Yes, he feels very justified in how he punishes or how he punished his children based on his religious beliefs. He believed that he should discipline them, that he had an obligation to discipline them. You know, there was lots of evidence of religious books and Bibles around his mobile home. He prayed with the children. He quoted scripture. He had them write scripture. He spoke in tongues. So he was very involved in his fundamentalist Christian life.
Regarding the actions of the deaths of Mira, Eli, Gabriel, and Elaine or Abigail, what was your conclusion?
It's my conclusion that because of his belief that they would be better off in heaven, and he did have, you know, he thought that through. He believed that they would be better with in heaven than without any parents. He was not thinking that there was another option to be with grandparents. It's my opinion that he was unable to distinguish moral right from moral wrong at that time.
Morally, he thought the right thing to do was to send his kids to heaven,
Yes.
rather than have to live the life that he had been through without a mother and with his conditions.
Yes.
One second. Dorney, please answer your questions. Stay.
Sure.
Graham?
Dr. Dorney, you said that you met with him for 8 times now, is that correct?
8 total, yes.
very first time you met with him, though, was 3 years after, it's actually the anniversary, wasn't it?
Yes.
Children being
Yes,
killed.
that's true.
So as far as what he told you at that time and how the story developed among sources, he had 3 years to think about it before you and him spoke, correct?
Correct.
As far as physical evidence of delusions leading up to August 28th of 2014, not his words, after the fact of after his arrest, the only thing I heard him talk about was his concerns about Mira and his concerns about Amber. Is that correct?
Specifically, what concerns are you talking about?
Well, you were talking about, you testified to that there was paranoia about Mira and there was paranoia about Amber during that summer. And while it was kind of a fluid situation, I think is exactly your words.
Right.
Because you were talking about how it's not fixed, long-held, false belief, but
Right.
somehow that's a delusion. That's what you testified to, correct?
He had general paranoid beliefs about his family members that started in the summer. One was about Mira. He believed that she could be schizophrenic. He also believed that his ex-wife could be a prostitute. And then as we got into the August month, he actually started having fixations about that his children and Amber were colluding against him. And then that's when all of that happened with Natan. So there's several pieces to it.
That's all self-reported, though, right there.
That part's self-reported. That part
If
is.
he told Dr. Frierson something different, that's something different, isn't it?
Yeah.
My question was, though, with proof, not his words, but proof. You have an internet search about Mira and schizophrenia and then a text back and forth to Amber. So he expressed concerns. Did you talk to him about that after the fact, that you can find out what that was about?
About which part with Amber? What?
Mira and his concerns.
Oh, yeah.
The internet search, he did an internet search for schizophrenia.
Correct.
And he texted Amber and said, we need to talk.
Yes.
What did he tell you about that?
He was afraid that she was going to be schizophrenic like his mother.
And
he felt like it.
The reason he told you, was it because Mira had an imaginary friend?
He said that she was talking to herself.
She was talking to herself. So how is that a delusion?
I think he was just afraid that it could be she was hallucinating and that she could be getting some kind of mental illness.
Right, but it's not a fixed long-term belief. It's a one-time event, and we don't even know whether it's true or not.
No, I don't think he knew if it was true. He was trying to figure out what was going on with her.
A normal thing that any parent would do, potentially.
I don't know. I don't know if I would jump to a conclusion that maybe my child's mentally ill based on that.
But we also shouldn't jump to the conclusion that that's a delusion either, should we?
Well, I think it's a piece of the whole thing I was talking about. It's not one specific thing. But as far as your question goes, the data that I had were those two pieces of data.
Okay.
I think that was your question.
Amber and prostitution, and there was also some internet searches about that.
Yes.
Just because you're paranoid about something or have concerns or worried or going through a divorce and maybe you think your ex-spouse might be prostituting, again, why are we going from a concern and anxiety of paranoia and jumping to delusional?
Because I think it was a pattern that started in that summer that was much more significant. And it escalated until the day of the offense.
I mean, the reason you're jumping to it is because you need delusion to get schizophrenia, correct? That's
No.
what supports your schizophrenia diagnosis is delusions.
It's one of them,
Okay.
but there are others. I mean, he certainly had negative symptoms too.
But each of those two on their own, a single event, is not a fixed, long-term false belief.
Correct.
Okay. You would agree with me that psychiatric diagnoses are subjective?
They can be. I mean, you can do some objective data to help with that. Yeah.
You can't do a blood test.
Correct. Yeah.
You can't do a brain scan and even say that someone's got a disease.
Right, they're just associations, yes.
They're associated. A lot of it has to do with your talks with somebody, what they tell you, what you observe, and then any other kind of data you can get.
Correct,
Different people reach different diagnoses all the time, don't they?
yes.
How heavily did you rely on Dr. Wood's diagnosis?
I mean, it was a significant component, but it certainly wasn't the determining factor. I mean, I think the fact that specifically when it comes to diagnosis, I think it's very helpful because she's had more contact with him than any of us. And she's provided treatment now for years for him. So from a diagnostic perspective, I think it has significant weight, but ultimately I make my own decision on diagnosis.
You heard her say that she never saw disorganized thinking.
Yes,
You heard her say that she never saw disorganized behavior.
yes,
You heard her say that nobody had any observation of him having an outward response to internal stimuli, meaning when he's hearing voices, he's not talking to them or gesturing to them or anything like that.
right, and I haven't seen that either.
You would agree with me that that's normal, though,
That's normal.
for people to respond. If there are voices in their head, for
Not-
them to have an outward response.
There certainly are patients that you can see that with who are actively psychotic, but once they're treated, you tend to not see that, even if they hear voices. So no, that's actually not correct.
Right. She saw him since the first day he walked in SCDC, and he didn't start taking Gedone until how long after? He didn't come in and take Gedone the first day he was there.
The 12th of September.
It was at least a month later, wasn't it?
No, it was not.
You have the records?
Yeah. I mean, I don't have the records, but it's the 12th of September when he started medication.
He started Gedone on what day, man?
I'll find it, just one second. One second. September 12th, 2014, which was just a few weeks, was actually about a week after his arrest, less than a week, he started on Gedone.
It quickly went up to 320 milligrams.
Yes.
You heard her also testify, and in the notes you reviewed, about the lingering or manipulated behavior that a head nurse complained of, correct?
I think, yeah, she agreed that that report had been there. I don't know that she agreed with the information, but she agreed that the report had been there.
And what does that effect have on your opinion? Because somebody has said that they saw him using manipulative type behavior.
Well, it's something I would consider. I mean, I think if there's a pattern of it, it's certainly important. If she had seen him malingering, I certainly would think that that's important. As anybody else has evaluated him, that would be important. So, but particularly in a treatment setting, that's important.
And you heard her testify saying that although her report, her records may show schizoaffective disorder, but she said that he did not fit into any mental illness box. That when you actually look to the criterion under the DSM-5, he did not fit into any box. That testimony.
I did not hear that. I know she's made the diagnosis of schizoaffective disorder.
Does that change your diagnosis in any way when a clinician who saw him for 4 years, whose job it is to see and treat people at SCDC, says, I couldn't really fit him in any box? Does that make a difference to you or not?
You know, I object to that as mischaracterization of her testimony. I think she said he doesn't fit neatly into any box.
I'll let him characterize it. he can characterize his question consistent with the testimony.
The record and the jury heard whatever they're going to say that she heard. My question to you is if the treating physician at SCDC who wrote down in their records a diagnosis, and you've testified to that that's important to you because that person saw them for so long, my question is when or if that person says they don't fit into any specific box, I could not meet all the criterion of what was required in DSM-5 to diagnose a particular illness, does that make any difference to your opinion?
It could. I mean, if that's what she believed. I mean, she's made the diagnosis of schizoaffective, but if that's what the jury heard, it could. However, what's in the record doesn't support that.
Well, what in the record supports schizoaffective disorder at all?
She basically referenced hallucinations and delusional thinking. She actually said negative symptoms this morning, which would support the schizophrenia side of things. And then she commented on the affective side, which is the mood disorder side, and spoke more to the depressive symptoms, not the manic symptoms. She said there was one period where he had some derailed speech, which could have been supported by manic symptoms, but she mainly focused on depression.
But your diagnosis is schizophrenia and bipolar, correct?
Schizophrenia, bipolar, I think she's saying depressed.
Right, so she would have whatever, I guess schizophrenia and depression if she had schizoaffective.
Well, she's diagnosing it as schizoaffective disorder, depressed, I think, based on from what I can tell.
I know you said you charge $400 an hour. How many hours do you think you put into this case?
Probably about 100 hours. You know, I will adjust off at least 25% of my fee because it's a government case, and adjust off all my travel. So
how many hours with him?
about 19.
And then 81 between reviewing things and coming here and testifying today, talking with whoever you needed to talk to.
Yes.
Your list of sources that you reviewed, I think was about 125 documents or 125 line items, is that correct?
Yes.
You were going through Mr. Jones' prior mental health history, and you started off with, I think, some drug use, and then him going into the Navy, right?
Yes.
And the diagnosis of coming out of the Navy was depression?
Depressive disorder and a history of substance use, yes.
And that could be attributed to him hurting himself, an injury, and not being able to recognize a dream, couldn't it?
Sorry, I didn't understand what you said.
Hypothetically, if he injured his hip and he was not going to be able to reach his dream of being a Navy SEAL and became depressed, that could explain that diagnosis at that time, couldn't it?
It could. There's just no reference to his hip in the documents.
You never asked him about it.
Yeah, no, I did ask him about it. He still thinks it's his hip.
So that's what he told you.
Yeah, but the documents don't support that. They support that he was
Documentation just has a diagnosis.
right, but he was referred to the psychologist because of the crying spells and the depression.
And my question to you again then is, I guess, couldn't the depression have come because he had a hip injury and he couldn't reach his dream? And you said yes, I thought.
Yeah, I guess it could, yes.
The next thing, doctor, that you talked about in his mental health, I think, was what?
It was around the time of his separation, and he actually was
His counseling with Dr. Haynes.
correct, yeah.
Is there a reason that you skipped over his evaluation from May of 2002 from the Department of Corrections of Illinois?
I didn't mean to. I don't know if I just wasn't asked that or what. I'm happy to talk about it.
Well, in that one, he was diagnosed polysubstance dependence. Do you
That
know
was his, when he was in prison, yes.
Polysubstance dependence means what?
Means that he had a history of substance abuse before he came into prison. And at that time, that was his arrest when he was arrested for stealing a car, I think in cocaine use, and he was drinking and smoking pot and had used some other drugs.
And for it, I guess, to reach the level of a diagnosis, because you can have symptoms, but until it impairs your
Functioning.
active life or have consequences like criminal consequences.
That's one thing. I mean, it can be related to tolerance and dependence on substances too.
His access to or another diagnosis was personality disorder, NOS, not otherwise specified. What does that mean?
So that's just what we call it. It's not a major mental illness, but it's actually enduring patterns of behavior that are maladaptive. And in his case, you know, if he had a history of antisocial acts or borderline personality, like chronic adjustment problems, it could contribute. I mean, I tend to not make that diagnosis in a one-time evaluation, but, you know, I think that particular evaluator did, so.
And in this case, it actually said narcissistic traits. What is
Yes. It's someone who actually is arrogant, entitled, basically attention-seeking, those behaviors.
that? Somebody who's selfish?
Could be selfish.
Spice, synthetic cannabinoids, can cause delusional thinking, can it?
Yes.
So the two outside proofs we have of the internet searches, if it's delusional, it could have been from Spice, couldn't it?
Possible.
You described him having manic behavior, grandiose thoughts. Why is manic behavior important?
Because it points to a major mental illness that's a mood disorder. And bipolar disorder can actually be associated with psychosis. And with psychosis, you can actually hear voices and have delusional thinking. So it all can actually be part of the mood disorder also.
So is your observation of manic behavior just in that time period, or is it something that's been going on for a really long time?
Oh, I think it escalated that summer. It's gone on this year. So I think, you know, with his med changes, we've seen it. So there's evidence years later that it's there, but it certainly had escalated during that summer period.
And it gets kind of confusing and sometimes because you were talking about manic behavior can give you goal-directed, which you saw in him by making calendars, I think, right?
I think it's just that high level of energy when you're manic and you every minute of the day you're planning and doing things. And so I was trying to kind of illustrate to the jury the structure of what he did each day, which to me is just off the chain. So.
But that kind of goes against one of the components of schizophrenia about being disorganized, doesn't it?
Well, that's the thought disorder side. This is the mood disorder side. This is why it's complicated and why I did the diagram, because there's overlap with a lot of that.
So when we're talking about the goal-directed activities, which side does it go to?
Mood disorder. Bipolar disorder. It's mania.
But it would dispute if you were going to say that he was not goal-directed or that he wasn't having clear thoughts.
Absolutely. You're right.
You had commented on, I think, his lack of sleeping leading up to his killing of his children, right?
Yes.
11 p.m. to 3 a.m. What day of the week was that?
I'd have to check. It was earlier in the week.
What was he doing, you
I just know that he was on the computer.
You know he was doing something on the computer, or the computer was on?
I think he was doing something on the computer. Yeah, that was actually on the 24th, so that would have been into the 25th. So that was Sunday night into Monday.
Do you know what he was doing on the computer?
I don't know.
So you don't know if he was doing work and there was some computer program running while he was sleeping? Do you?
I don't know that. I just know he also had told, he basically said he wasn't sleeping at all, so.
But for actually, you know that there's computer usage for those times of the days that you said, but you don't know whether he was really doing anything or what was going on.
I don't know what all he was doing during that period.
You made a point of talking about his calendar of activities and how he was becoming very regimented, I guess, in what he was doing. How long had that been going on?
There's, when you look at the records, it looks like some of that started actually back in July, but just his plans to exercise, structured time for prayer and reading to his children, and then the day trading piece is not clear to me, but I think it started during that month before. But the Google Calendar to me was much more in line with when the offense happened. That was in August.
So you would agree with me that all of the things that you brought forward as far as manic behavior and delusional that you testified to and that we've discussed, all that was basically during the summer of 2014?
Well, not all of it, no. I think it escalated during that window in August, but he's had symptoms to this day, and he had depression before that. So the illness hasn't gone away. It's still requiring treatment, and he still has symptoms.
Right, but I guess my question to you was the things you highlighted, the calendar and activities, the not sleeping, paranoia or delusions about his family, manic behavior, all that, the examples you gave were during the summer of 2014.
Right, because that's what I was asked to assess, is that particular manic episode, that period of time, the detail of that.
And you would agree with me that period of time is when he began to use spice and use it heavily?
He started using spice actually a few months before that, and I would challenge why, if he started using a few months before, this behavior didn't happen beforehand, if it was all from the spice.
Why didn't it happen in years before then? If it has
I'm sorry, I didn't hear you.
If it has nothing to do with the drugs, why didn't it happen years before?
I think it was an accumulation of everything. This is a man who went through a terrible divorce. He has custody of his 5 children. He wanted to change. He was not doing well at work. It was a series of things. He was overwhelmed. I think it came to a head at that point.
And drugs made it worse.
And drugs made it worse.
Whatever was there, whether there was a major illness, a diagnosable illness, or just paranoia, stress, or whatever, drugs made it worse.
In my opinion, there was a diagnosable illness, and drugs did make it worse.
I understand that, but even if there wasn't a diagnosable illness, drug spice would be a problem, wouldn't it?
Could be.
Something caught my attention when you were describing what he told you about when he killed his children that I wanted to ask you about.
Okay.
Your timeline of events that were reported to you, he accidentally PTs Natan too hard and goes to check on him, shakes Natan. Did he describe what shaking was?
Yeah, he showed me. He didn't.
It wasn't a violent shaking?
He did not say that it was a violent shaking.
He showed you.
Yeah.
And then he realizes Natan collapses and dies.
Yes.
How long of a time period is between there and when he kills his children? his
He,
remaining
he
children?
couldn't give me an exact time period. He didn't know how long it was. He did know he went to get cigarettes and he came back and it happened, but it wasn't clear as to how long the time was. So
Did he tell you whether he went to get cigarettes by himself, or did one of the children go with him?
he went with Mira. Mira went with him.
And you don't know what time
I
the
don't.
purchase was?
Yeah.
Does the time difference matter?
Yeah, I mean, I think it could. I don't, I mean, I think it could.
In what way?
Well, if it was closer to the time of the first death, it could kind of raise questions more on impulsivity. If he came back and he was thinking it through, because we're kind of talking about the capacity issues related to moral wrongfulness, and he was thinking about it, I think it could actually go more to what he was thinking from a disorganized standpoint. So I think it's more impulsive if it's closer. It's less impulsive if it's not.
So, what's your understanding of about when Tom died? From his,
Around 7:40 or between 7:30 and 8:30.
and you're not aware that there's a receipt where he goes to the gas station at 1:50 a.m.?
I'm aware that there's a receipt. I just didn't know the time period on that.
So that would put it from 7:40 to 1:50 is 5 hours later.
Yes.
So it would have given it a long time to think,
Yes.
wouldn't it?
Yes.
Eli, according to you, according to Mr. Jones, said, "Daddy, take me with you."
Yes.
Did you follow up and ask why?
No.
What's going on?
Well, I just know he had a really good relationship with Eli, but I don't know why other than what he told me.
I guess my question is how did Eli know he was going anywhere?
Well, that's a good question. I don't know.
Because Natan's dead, and what's he doing?
Good question.
We don't know whether he was packing up to go and then changed his mind and killed his children, or what, do we?
Well, there wasn't any dialogue about going anywhere else, so.
Mira was saying, I think, I'm not sure that it came out, but it's in your report on page 24, as he was killing Mira, Mira was screaming, "No, no, no." You would agree with me, or not, that would show, or at least should give him pause to the wrongfulness of his actions.
It should, and with a rational person, it should. It did not. And I think the fact that he has told Dr. Frierson and me that story isn't, I mean, he volunteered to say that, so he certainly didn't sugarcoat that at all.
I think when the next you were talking about, I think his psychiatric intake maybe at the Lexington County Detention Center on September 11th of 2014.
Okay. Let me just get there. All right, on page 25.
I thought earlier, you heard that he told you that he had permutations and you attributed that to maybe being confined.
Mm-hmm. Yes.
And that was really atypical, meaning it doesn't fit in with any
Right.
of the other symptoms or behavior that he was explaining.
True.
However, in the September 11th, 2014, what you read, he's already reporting that he's seeing things there, isn't he?
Right. And that's 4 or 5 days after he was in jail.
That shouldn't, if it's related to being confined, it shouldn't be shown up yet.
I guess it could. I don't know for sure.
Does that seem,
It's a good question. I mean, he clearly had been in jail for 4 days, and I guess if he's just sitting in a jail cell, he could start to see. It's like an illusion. You look at a wall long enough, you can start to see things move. That's how I've interpreted it. It's just lack of sensory deprivation, just sitting in a very small confined area. I don't think he's had that outside of a jail setting.
are you aware of anyone, is it atypical or not for someone to complain of seeing permutations if the reason is confinement after 4 days?
Is it atypical? I think it's certainly possible. I can't say that it's atypical. I think I also mentioned sleep deprivation can do that also.
And then I think you talked about the August 7th interview with law enforcement in Mississippi where he came into the room and was screaming about being mentally ill and being schizophrenic and hearing voices, right?
It was actually September 7th, not August 7th.
I'm sorry, yes. My bad, thank you, doctor. September 7th.
Yes.
And you found that important. Why?
Because I think it shows that he's reporting hallucinations at the time of his arrest, and he has not had any interaction with mental health professionals at that point who could have implanted that or given him the idea to feign those symptoms. He spontaneously says all of that, really just kind of rambling.
Isn't it true that people who are truly mentally ill and going through psychotic events don't come forward and admit it? In fact, they don't believe it. True?
Well, if they're functioning out in the world, they don't. Oftentimes, they'll hide it. But in a jail setting, if they're that dysregulated, they often do report it.
So a homeless person who's picked up on the street, hypothetically, who's suffering from a psychotic event in the middle of a psychotic episode, they get picked up by law enforcement. Do they admit they're psychotic? Or do they continue to deny it because they don't believe it?
Some do and some don't. I don't think you can make a generalization about that.
You would agree with me, though, that it is possible that Mr. Jones walked into that room knowing that he was going to have to talk with law enforcement, seeing his father, knowing that he's going to have to answer questions about where the children are. And he put that out to protect himself or to go ahead and set up talking about a mental illness when it really had nothing to do with it. That's a possibility, isn't it?
That's a possibility, and also asking for an attorney is. And he did not do that.
That's not true. And the judge has already ruled on that.
Well,
Ma'am,
Yeah.
Your Honor.
We're not talking about legal issues.
Okay.
Is it a good time to take a lunch break, Mr. Graham? You got more? Is that suitable? Okay. Y'all got lunch plans? Enjoy your lunch. Don't talk about the case. See you back in a little bit. See you back when you get them back. Agent.